What if I told you that Zambia could soon be malaria-free? That thousands of lives, especially children, could be saved in just a few years? President Hakainde Hichilema isn't just talking about it. He's taking real action. In a major move, HH has partnered with the End Malaria Council to launch one of the most ambitious health campaigns Zambia has ever seen. Here's what you need to know. Zambia President Hakainde Hichilema has announced a powerful national strategy to eliminate malaria in Zambia during a key meeting with the End Malaria Council (EMC). This bold initiative aims to drastically reduce malaria deaths and create a healthier, more productive Zambia. In this video, we break down white heavy checkmark the goals of President HH's anti-malaria campaign. White heavy checkmark what was discussed in the meeting with EMC. White heavy checkmark how the government and global donors plan to fight malaria. White heavy checkmark when and how this plan will be implemented across Zambia. White heavy checkmark why this matters for every Zambian family. Speech balloon: is Zambia ready to be malaria-free? Let us know your thoughts in the comments. Don't forget to subscribe to InspirAfrica Official for powerful and informative stories about Zambia's future. Loudspeakers share this video to raise awareness and be part of the change. The fight against malaria begins. Malaria remains one of the most significant public health challenges in Zambia, a country where the disease is endemic and a leading cause of morbidity and mortality, particularly among children under 5 and pregnant women. President Hakainde Hichilema, often referred to as HH, has prioritized malaria elimination as a cornerstone of his administration's health agenda, aligning with global goals to eradicate malaria by 2030. His anti-malaria campaign is not a standalone initiative, but part of a broader vision to improve health outcomes, strengthen health systems, and promote socio-economic development in Zambia. The campaign builds on decades of progress in malaria control, leveraging partnerships with local communities, the private sector, and global donors to achieve sustainable impact. The fight against malaria in Zambia has seen significant strides since the early 2000s, with interventions like insecticide-treated nets (ITNs), indoor residual spraying (IRS), and artemisinin-based combination therapies (ACTs), reducing the malaria burden. However, challenges such as drug resistance, insecticide resistance, climate change impacts, and funding disruptions threaten to reverse these gains. President HH's campaign aims to reinvigorate efforts, emphasizing domestic resource mobilization, innovative financing, and community engagement to ensure no one is left behind in the quest to end malaria. This section explores the historical context of malaria in Zambia, the renewed commitment under HH's leadership, and the strategic importance of the campaign. It sets the stage for understanding why malaria elimination is a priority and how HH's vision aligns with national and global health objectives. Historical context of malaria in Zambia. Malaria, caused by Plasmodium parasites and transmitted by Anopheles mosquitoes, has long been a public health crisis in sub-Saharan Africa, including Zambia. According to the World Health Organization, WHO, Africa accounted for 95% of global malaria cases and 97% of deaths in 2023, with Zambia being one of the high-burden countries. Historically, Zambia's malaria control efforts were limited before 2000, focusing primarily on treatment rather than prevention. The establishment of the National Malaria Control Program (NMCP) and later the National Malaria Elimination Program (NMEP) marked a shift toward integrated approaches, including prevention, diagnosis, and treatment. Between 2000 and 2010, Zambia made remarkable progress, reducing malaria incidence and mortality through partnerships with organizations like the U.S. President's Malaria Initiative (PMI), the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and the Rollback Malaria (RBM) partnership. By 2018, the country aimed to eradicate malaria by 2021, a goal that, while ambitious, was not fully achieved due to persistent challenges like funding shortages and systemic issues. Despite these setbacks, Zambia's efforts have been globally recognized, with initiatives like the End Malaria Council (EMC) positioning the country as a leader in malaria elimination in Africa. HH's anti-malaria campaign, a new chapter. Elected in August 2021, President Hichilema has made health a central pillar of his administration's agenda, with malaria elimination as a flagship initiative. His campaign is driven by a recognition that malaria not only claims lives, but also hinders economic progress by affecting workforce productivity and increasing healthcare costs. The campaign builds on existing frameworks like the National Malaria Strategic Plan and the EMC, which HH has actively supported. His designation as the African Union AU champion for cholera outbreak response in 2025 also underscores his commitment to tackling infectious diseases, including malaria, through high-level advocacy and resource mobilization. The fight against malaria under HH's leadership is characterized by a multi-pronged approach: strengthening health systems, investing in healthcare infrastructure, training health workers, and ensuring the availability of diagnostics and treatments. Community engagement, promoting behavior change, such as consistent use of ITNs and seeking prompt medical care for fevers. Innovative financing, mobilizing domestic resources and private sector contributions through the EMC and other platforms. Global partnerships, collaborating with international donors like PMI, the Global Fund, and WHO to sustain funding and technology technical support. Innovation and technology, exploring new tools like gene drive technology and next-generation ITNs to combat resistance. This renewed focus comes at a critical time as global funding cuts, particularly from the US, threaten to derail progress. HH's campaign emphasizes self-reliance and resilience, urging Zambia to strengthen its treasury to procure essential medicines and reduce dependence on external aid. Why the fight matters. Malaria's impact extends beyond health, affecting education, economic productivity, and social equity. In Zambia, where 11% of the population lives with HIV, malaria co-infections exacerbate health challenges, particularly in rural areas where access to care is limited. HH's campaign is a call to action to protect vulnerable populations, reduce health disparities, and achieve Sustainable Development Goals, SDGs. By prioritizing malaria, HH aims to create a healthier, more prosperous Zambia, where families are free from the burden of preventable diseases. Malaria in Zambia. Why it matters. Malaria is a critical public health issue in Zambia due to its widespread prevalence, significant mortality, and socio-economic consequences. Understanding why malaria matters requires examining its epidemiology, impact on communities, and the broader implications for national development. This section delves into the burden of malaria in Zambia, its effects on families and the economy, and why it remains a priority for HH's administration. The burden of malaria in Zambia. Zambia is one of the 30 countries targeted by the U.S. President's Malaria Initiative, PMI, as a moderate burden country, accounting for a significant share of global malaria cases. According to the 2024 Africa Malaria Progress Report by the African Leaders Malaria Alliance, ALMA, Africa accounted for 251 million malaria cases and nearly 580,000 deaths in 2023, with Zambia contributing to this burden. Children under 5 and pregnant women are the most affected, as malaria can lead to severe anemia, low birth weight, and maternal mortality. The disease is transmitted year-round in Zambia, with peaks during the rainy season when mosquito breeding sites proliferate. Rural areas, where healthcare access is limited, bear the brunt of the disease, with 86% of households in surveyed provinces using ITNs nightly, a significant improvement but still below the target of 90%. Despite progress, challenges like insecticide resistance and environmental factors, such as flooding, continue to drive malaria transmission. Socioeconomic impact. Malaria's toll on Zambia extends beyond health. Economic costs. Malaria-related illnesses result in lost productivity as adults miss work and children miss school. The cost of treatment and hospitalization strains household budgets and the national healthcare system. Education. Frequent malaria infections disrupt schooling, contributing to absenteeism and lower educational attainment, particularly in rural areas. Health inequities. Marginalized communities, including those in remote areas, face barriers to accessing prevention tools and treatment, perpetuating health disparities. Co-infections. The high prevalence of HIV in Zambia, 11%, increases the risk of severe malaria outcomes, complicating treatment and care. Why it matters for Zambia. Malaria matters because it undermines Zambia's development goals. The disease's impact on children and pregnant women threatens future generations, while its economic burden hinders poverty reduction efforts. HH's administration recognizes that eliminating malaria is essential for achieving SDGs, particularly those related to health, SDG 3, poverty reduction, SDG 1, and economic growth, SDG 8. Moreover, malaria control aligns with the principle of leaving no one behind, ensuring equitable access to health services for all Zambians. The urgency of the issue is heightened by emerging threats like anti-malarial drug resistance, with molecular markers of artemisinin resistance detected in Zambia. Without sustained efforts, progress could stall, leading to a resurgence of cases and deaths, as seen during the COVID-19 pandemic, when disruptions caused an estimated 14 million additional cases globally. What HH discussed with the End Malaria Council. The End Malaria Council, EMC, in Zambia is a multi-sectoral platform that brings together government, private sector, traditional leaders, faith-based organizations, and civil society to advocate for malaria elimination and mobilize resources. President HH's engagement with the EMC reflects his commitment to high-level leadership in the fight against malaria. While specific details of recent meetings between HH and the EMC are not fully documented in the provided sources, available information and broader context allow us to infer key discussion points based on the EMC's role and HH's priorities. The role of the End Malaria Council. Zambia was the first African country to establish an End Malaria Council, a model that has since been adopted by countries like Kenya, Eswatini, Mozambique, Uganda, South Africa, Cameroon, and Burkina Faso. The EMC facilitates resource mobilization, advocates for policy changes, and promotes community engagement. It has raised over $125 million collectively across 9 African countries, demonstrating its effectiveness. In Zambia, the EMC includes private sector and traditional leaders who launch malaria enterprises to raise awareness and create sustainable funding sources. Key discussion points. HH's discussions with the EMC likely focused on the following areas. Resource mobilization. HH emphasized the need for domestic funding to reduce reliance on external donors, especially in light of U.S. funding cuts. In March 2025, he noted that the U.S. cuts were a slap on both cheeks, urging Zambia to strengthen its treasury to procure medicines. The EMC's role in mobilizing private sector and community contributions was likely a key topic. Integration with national plans. The EMC supports integrating malaria goals into national development plans. HH likely discussed aligning the campaign with Zambia's National Health Strategic Plan and National Development Plan to ensure malaria elimination is a priority across sectors. Community engagement. The EMC's faith leaders advocating for malaria elimination, FLAME initiative, and other advocacy campaigns were likely highlighted. HH may have emphasized scaling up community-based interventions such as ITN distribution and behavior change communication, as seen in the 86% ITN usage rate in surveyed provinces. Addressing systemic issues. The theft of donated medical supplies, including anti-malarials, was a major issue raised by the U.S. Embassy, leading to a $50 million aid cut in 2025. HH likely discussed strategies to combat corruption and strengthen supply chain management with the EMC. Innovation and technology. The EMC's focus on innovative financing and interventions, such as malaria enterprises, suggests discussions on adopting new tools like gene drive technology to reduce mosquito populations. Outcomes and commitments. While specific outcomes of HH's meetings with the EMC are not detailed, the broader context suggests commitments to strengthen advocacy through traditional and faith leaders, launch new malaria enterprises to fund interventions, enhance accountability mechanisms to prevent theft and ensure aid reaches intended beneficiaries, support global advocacy such as replenishing the Global Fund as emphasized by African leaders at the 2024 Australian Dollar Summit. Who is supporting the initiative? The fight against malaria in Zambia is a collaborative effort involving the Zambian government, global donors, and local stakeholders. President HH's campaign leverages these partnerships to maximize impact, but recent funding cuts have underscored the need for diversified support. Key supporters. Zambian government. The government, under HH's leadership, has prioritized malaria in its National Health Strategic Plan and National Development Plan. It oversees the National Malaria Elimination Program, NMEP, and coordinates with the EMC to mobilize resources. In response to U.S. aid cuts, HH has called for increased domestic funding to procure medicines and strengthen health systems. U.S. President's Malaria Initiative, PMI. The U.S. has been the largest donor to malaria efforts globally, contributing $805 million in FY 2025 through PMI and the Global Fund. In Zambia, PMI has supported ITN distribution, IRS, and anti-malarial drug provision, helping reduce malaria deaths by 75% over the past decade. However, a $50 million cut in 2025 due to theft of donated supplies has disrupted programs, though a limited waiver allows some life-saving services to continue. Global Fund to fight AIDS, tuberculosis, and malaria. The Global Fund, to which the U.S. contributes 33%, invests over $5 billion annually in more than 100 countries, including Zambia. It supports 30% of malaria activities globally and has been critical to Zambia's progress. The fund's 2026 to 2028 cycle seeks $18 billion to continue its work, but delays in donor pledges, including from Kenya, highlight funding uncertainties. World Health Organization, WHO, who provides technical guidance, certifies malaria-free countries, and coordinates global strategies like the Global Technical Strategy for Malaria 2016 to 2030, aiming to reduce malaria incidence and mortality by 90% by 2030. In Zambia, who supports efforts to address anti-malarial drug resistance. African Leaders Malaria Alliance, ALMA, chaired by African heads of state, promotes malaria elimination across the continent. Zambia's EMC is part of ALMA's network, which has raised significant funds and advocated for increased domestic resources. Private sector and community organizations. The EMC includes private sector partners and traditional leaders who launch malaria enterprises and advocacy campaigns. Faith-based groups like FLAME play a key role in community mobilization. Organizations like the Johns Hopkins Center for Communication Programs conduct surveys like the Malaria Behavior Survey to inform interventions. Other donors. The Gates Foundation, UNITAID, and other partners collaborate with WHO and the Global Fund to address drug resistance and expand access to treatments. The World Bank, African Development Bank, and Islamic Development Bank have provided credits for health interventions in other countries, suggesting potential support for Zambia. Challenges in donor support. Recent U.S. funding cuts, driven by concerns over theft and mismanagement, highlight vulnerabilities in Zambia's malaria programs. The Trump administration's broader review of foreign aid, including proposed cuts to the Global Fund, poses further risks. HH's campaign seeks to mitigate these challenges by fostering self-reliance and diversifying funding sources through the EMC and private sector engagement. How will it be implemented nationally? The implementation of President HH's anti-malaria campaign across Zambia involves a multifaceted strategy that integrates prevention, treatment, and advocacy. While specific details of the implementation plan are not fully outlined in the sources, we can infer a comprehensive approach based on existing frameworks, HH's statements, and ongoing initiatives. Key implementation strategies. Scaling up prevention. Insecticide-treated nets, ITN's mass distribution campaigns, conducted every 3 years, aim to achieve 90% coverage. The 2024 Malaria Behavior Survey showed 86% of households in surveyed provinces use ITNs nightly, with plans to increase this to 90%. New generation ITNs, effective against resistant mosquitoes, are being prioritized. Indoor residual spraying, IRS-targeted spraying in high-burden areas will continue, focusing on rural communities where transmission is highest. Malaria vaccines. While not explicitly mentioned in Zambia's context, the rollout of vaccines like our 21/Matrix-M in other African countries suggests potential future adoption. Strengthening diagnosis and treatment. Rapid diagnostic tests, RDTs, and ACTs will be distributed to ensure prompt diagnosis and treatment, particularly for children and pregnant women. Addressing anti-malarial drug resistance, detected in Zambia, will involve introducing alternative treatments like triple artemisinin-based combination therapies. Community engagement and behavior change. The EMC's advocacy campaigns, including those led by Flame, will promote behaviors like ITN use and seeking prompt medical care. The 2024 survey showed 85% of caregivers seek prompt treatment for fevers, a significant improvement. Community health workers will be trained to distribute nets, educate communities, and monitor malaria cases, as seen in past initiatives. Health system strengthening. Investments in healthcare infrastructure, including supply chain management, will address issues like theft, which led to U.S. aid cuts. Training health workers and improving diagnostics will enhance service delivery, particularly in rural areas. Innovative technologies. Exploring gene-drive technology to reduce mosquito populations, as pioneered by Target Malaria, could be part of the long-term strategy. Digital tools like the interactive MBS dashboard will help officials monitor progress and target interventions. Resource mobilization. The EMC will launch malaria enterprises to create sustainable funding sources, reducing reliance on donors. HH's call for increased domestic funding will involve reallocating national budgets and leveraging platforms like the World Bank's IDA and the Green Climate Fund. Timeline and national rollout. While specific timelines are not provided, the campaign aligns with the WHO's Global Technical Strategy for Malaria 2016 to 2030, targeting a 90% reduction in incidence and mortality by 2030. Key milestones include short-term 2025 to 2026 strengthen ITN and IRS coverage, improve supply chain integrity, and scale up EMC advocacy campaigns. Medium-term 2027 to 2028 introduce new anti-malarials and potentially malaria vaccines, expand gene drive pilots, and increase domestic funding. Long-term 2029 to 2030 achieve significant reductions in malaria burden, positioning Zambia for malaria-free certification. The rollout will prioritize high-burden provinces like Luapula, Northern, Muchinga, and Eastern, where malaria prevalence is highest. Rural areas will receive targeted interventions, while urban centers will focus on awareness and diagnostics. Final thoughts. Can malaria really end in Zambia? The question of whether malaria can be eradicated in Zambia is both aspirational and complex. While significant progress has been made, challenges like funding cuts, drug resistance, and climate change pose significant hurdles. However, HH's campaign, supported by the EMC and global partners, offers a pathway to success if implemented effectively. Reasons for optimism. Proven interventions. ITNs, IRS, and ACTs have reduced malaria incidence by 38% and mortality by 60% in Africa since 2000. Zambia's 75% reduction in malaria deaths over the past decade demonstrates the effectiveness of these tools. Community engagement. High ITN usage, 86%, and improved care-seeking behaviors, 85%, show strong community buy-in. Leadership and advocacy. HH's role as AU champion and the EMC's success in mobilizing resources provide political and financial momentum. Innovation. New tools like gene drive technology and next-generation ITNs offer hope for overcoming resistance. Challenges to overcome. Funding gaps. U.S. aid cuts and uncertainties around global fund replenishment threaten sustainability. Systemic issues. Theft of medical supplies undermines trust and aid effectiveness, requiring robust governance reforms. Drug and insecticide resistance. Artemisinin resistance in Zambia and organophosphate resistance in West Africa necessitate new treatments and prevention methods. Climate change. Increased flooding and extreme weather events exacerbate malaria risk, as seen in Pakistan's 2022 floods. Path forward. Ending malaria in Zambia is achievable but requires sustained commitment. HH's campaign must focus on strengthening governance to prevent theft and ensure aid reaches communities, diversifying funding through domestic resources and private sector partnerships, scaling up innovative technologies and vaccines to stay ahead of resistance, engaging communities to maintain high intervention coverage and behavior change. If these efforts are sustained, Zambia could move closer to malaria-free certification by 2030, joining the 45 countries already certified by WHO. The impact on Zambian families, reduced mortality, improved health, and economic stability would be transformative, making the fight against malaria a legacy-defining achievement for HH's administration.